Hello, my name is Adela Reyes, and I decided to do a literature review on end-of-life care decisions for underserved Hispanic populations in South Texas. End-of-life care decisions are more difficult for Hispanic minorities here in South Texas because they're usually misinformed on how to make those end-of-life care decisions, especially during a medical crisis or an emergency situation in order to have a good death. Poor communication with the clinicians and family leads to 59% of deaths in the ICU. And this is due because of language barriers, people not having the same cultural values and beliefs. So when there's a problem situation, usually you have to have a translator or someone who can let you know what the procedures are going to be done or what the diagnosis is, in order to be able to help treat or intervene with the surgical procedure. And most of the time it's miscommunication with family members that can affect the outcome of an individual. And a lot of times families just rely on their hope and their faith just to make their families feel comfortable during that time of need. When a loved one is in an ICU unit, it is difficult for families to make decisions on end-of-life care. A lot of times you feel helpless, alone. I don't know if you've ever had someone in an ICU unit. You see all the equipment and everything that's surrounding them to help them breathe, that you feel that you can't do anything to take away the pain and suffering for your family member. So it's better to communicate before this happens, because once they're in this situation, it's difficult to have the person in the ICU unit explain or let you know what they want as their final wishes. When family members are in an ICU unit, it's more difficult because people are already stressed because of their family member being so close to death. So there's a lot of confrontations among family members. So it's best to have an effective communication system so that you'll be able to speak with the doctor and the nursing staff and decide whether or not to keep the family member on life support to keep them breathing with a machine, or to have them die in peace. And also, death is no longer a natural process, but a failure of modern medicine. Some of the challenges to end-of-life care is language barriers. Hispanics here in South Texas, a lot of the elderly do not speak any English, so they have a difficult time with translation or finding a translator so that they can run diagnostic testing and or have a surgical procedure. They need to sign a surgical consent, so they need a family member to do that, to intervene for them. And a few people, very few, decide to talk about end-of-life crisis situations. So once this happens, there's a lot of miscommunication, and a lot of the Hispanic minorities, in their cultural beliefs, they rely not only on their family members to help them through the situation, but they rely on their faith to make their final wishes on death and dying. Religion and spirituality are important in the Hispanic culture. A lot of times they don't believe they're going to get ill, so they rely on their faith when it comes to end-of-life decisions. That means the older people and women in particular have faith and use the spirituality because they believe in the afterlife and support, social support. They have a lot of more family members, and they have a lot of church members that help them when they're ill. So they rely on their spirituality to help them through this crisis. This is why person-centered care is important for those that are suffering, especially from dementia or Alzheimer's disease. There are 4 essential elements, which are the VIP. The V is for the value. that all humans are regarded the same regardless of their age or cognitive ability. Every person as an individual should be recognized as being unique, and their health care also should be planned according to their cultural beliefs, and also understanding the world from the perspective of the service user. And S is for providing social environment that supports psychological needs. So in the Hispanic culture, there's a lot of familismo, in which the family is considered the center of support for the elderly, and they usually provide their personal care at home, and it's very rare that they use outside services for the end-of-life care decisions. This is why it's important to have a living will to avoid any legal issues. This advance directive is important so that when a family member goes into the hospital, their wishes are documented within their chart on whether or not they want to have a CPR in case they stop breathing, such as having a congestive heart failure, heart attack, or they want to be resuscitated in case they're no longer able to communicate, so that they can do chest compressions. So it's very important because once there's a life crisis, families are confused. They don't know what their loved ones would have wanted, whether or not they want them to keep on a ventilating tube. So in order to avoid any problems, it's best to have all these legal issues taken care of before there is a problem. This is why it's important to have the best plan of care options because according to the National Hospice and Palliative Care Organization, only 10% of the Hispanic population uses hospice service. And also, since Alzheimer's disease is increasing in the last couple of years, it's gone from 5.5 million in 2010 to an estimated 8.7 million in the year 2030. So this means that we're going to be needing more hospice care services in the future to help not only the Hispanic population, but all the elderly worldwide. In order to improve the end-of-life care decisions, it is important for the doctors and nursing staff to make the family members aware of the different type of sources there is to help, such as palliative and hospice care, which can be used not only at home, but they can be sent to a nursing facility if the person is in need of 24-hour care to help relieve the caregiver burden. And they should be able to be offered to all family members and of all ages, gender, or culture. This is why it's important to have a human connection, and these are 10 steps on what to say and do. You want to make sure that the patient understands the medical situation, the prognosis, and the different type of treatment options that are available, and also communicate with the family by gathering them in a room in a quiet area so that they can ask the doctor any medical questions that they may have. And also make sure that the patient is in the room. Even though they may have cognitive disability, they still should be included in the conversation. And just let the patient know what was found, and let them process the information, so that way you want to make sure that they understood what is being said and what the chronic disease or terminal illness they have, so that you can document and write everything down to avoid any legal problems as well.